Pediatric sleep disorders. Definition: sleep is a psychological state whose alteration or absence produce cause significant adverse effect. In children, the poor quality of the sleep affects the school performance and her or his state of mood. It can also influence in physical activities. There are some reasons for getting some diagnosis of sleep disorders and start the treatment.
We didn't know what was happening.
I was too afraid she'd quit breathing and not wake up.
I was falling asleep in class a lot.
All we knew is that he was having these problems at night, night terrors, and there was nothing that could be done. We didn't know what to do. It was inconsolable, and we were just at a loss.
Sleep disorders are very common in the pediatric age group. Almost 15 to 20% of the children suffer from some sort of sleep disorder at some point of time. The sad part is that almost half the physicians who are primary practitioners don't even ask about sleep disorders, knowing very well that children spend almost 50% of their time asleep when they're young. The entire impact of sleep disorders is huge, and help is there. We have an exclusively child-friendly pediatric sleep disorder center at Cleveland Clinic. We are here to help you solve your child's sleep problems.
When you have a sick child, whether it's a simple cold or whether it's the fact that they're not sleeping at night, you want to make it right. You want to trade places with them. You want to do whatever you can. You have to do whatever.
Classification. First, primary sleep disorders. Second, sleep disorders relate to medical conditions. And third, sleep disorders relate with other disorders.
And you have to do whatever you can.
Well, we are a very child-friendly center, right down from our front desk staff up to our technicians who take care of the children at night. All are trained to be friendly with the children, to keep them comfortable, and to understand the anxiety and the trouble the parents are going through. Children can suffer from a variety of sleep disorders: bedtime struggles, night awakenings in children and infants, sleepwalking, sleep terrors, snoring, sleep apnea, bedwetting, narcolepsy, and movement disorders in sleep like restless leg syndrome and limb movement disorder at night. Sometimes we also see seizure disorders, but these are some of the things that we see very, very commonly in the Sleep Disorder Center.
First, primary sleep disorders. These two, parasomnias and dystomias, are not consequence either of a medical or mental disease or ingested substance. It results from an endogenous disturbance in sleep-awake generating or timing mechanisms, often complicated by behavioral conditioning. Parasomnias, characterized by abnormal behaviors or unusual experience that occurs during sleep. It is nightmares, sleep terror disorders, and sleepwalking. Dystomias, characterized by abnormalities in a mode, timing, or quality of sleep. Primary insomnia and hypersomnia, narcolepsy, sleep apnea, circadian rhythm, and sleep disorders. Second, sleep disorders relate to medical conditions. Sleep disturbances due to the direct psychological effect of a general medical condition on the sleep-wake system.
Well, what's going to happen to my son?
On the night of the study, the child should have anything that makes the child comfortable. If there's a particular pillow, a blanket, a stuffed animal, a pajama, to make that child feel like they are at home.
I need to mention here that the sleep study does not hurt at all. It is just stickers and a lot of wires and monitors, but they're all stuck onto the head and in the face, chest, etc., to help us monitor the various aspects of the child's physiology at night. The test usually takes about 8 hours or so. We like to have enough sleep during the testing to be able to make a meaningful judgment on what is going on at night. But again, it doesn't hurt at all.
And third, sleep disorder rate with other disorders. Sleep disturbance due to diagnosable mental disorder. It is sufficiently severe to warrant independent clinical attention. Recommendation: dark room, quiet, proper temperature, schedule regular bedtime and wake up, night routines, avoid TV and scare stories.
About her seeing people that she didn't know and familiar with, because we have been seeing so many specialists. I wasn't sure how she was going to deal with the whole situation.
The first step in evaluating anyone with a sleep complaint is to take a sleep history, because there are many types of sleep disorders, and some of them require testing in a laboratory setting, while some of them can easily be diagnosed through an interview with a patient. We encourage the parents to come and take a tour of the lab because we want them to be at ease when they come in. We need to know all of the child's special needs. We need to know what's going to make that child comfortable. We need to make the parents comfortable. So we want parents to ask questions. We want to talk to you. We want to communicate and make sure that we are all on the same page the night of the study so we can make this as seamless a process as possible. The rooms